Over the past decade, the intake of fruit and vegetables among breastfeeding mothers in Hong Kong has increased significantly. However, the overall level of intake is still lower than recommended by the Dept of Health. Helen Chen with more.
During the survey, the Research Institute for Future Food under the Hong Kong Polytechnic University collected the dietary records, weight, and blood lipids of about 80 breastfeeding mothers and compared the data with figures from 2014.
In general, they have improved their intake in terms of vegetables, fiber, and vitamin A. Intake level are still, in general, lower than the dietary recommendations.
Over the past decade, the vegetable intake of breastfeeding mothers has increased by 34%. Dietary fiber intake has gone up by 19%, and vitamin A intake also up by 20%. But all are still lower than the recommended intake suggested by the Dept of Health by 22 to 103%. Only 10% of breastfeeding mothers meet the recommendation of eating 2 servings of fruit and 3 servings of vegetables each day. The study also looked at the weight and blood lipids of the breastfeeding mothers.
Have suffered from the high lipid problem as well as the obesity problem.
The research team said that if cardiovascular health is not ideal during pregnancy, children may experience obesity problems growing up. They recommend consuming different types of vegetables and fruits to ensure a balanced diet.
Experts say that from the perspective of Chinese medicine, postpartum mothers should avoid eating cold foods during the confinement period, such as watermelons and bitter melons. However, apples and papayas are among suggested fruits. Helen Chen, TVB News.